Do you have knee pain that is bothering you for months? Have you tried painkillers, creams, or gels, or have you just ignored it and carried along? But did you know that chronic knee pain can be caused only by a handful number of conditions, and timely diagnosis can prevent you from harmful conditions in the future? In this video, I will explain you the 5 most common causes of chronic knee pain, how to recognize them, and when to seek medical attention rather than just putting up with the pain. Hello, I am your knee doctor Niraj Radhamani, one of the Indian and UK trained orthopedic knee surgeons. I'm here to share evidence based advice on knee surgery. This will help you understand and manage knee problems. Let us look at the 5 common causes of chronic knee pain. The first condition is osteoarthritis of the knee, which is the most common condition. The common symptoms include pain while walking, pain while going up and down the stairs, crunching or grinding sensations in the knee, and swelling on and off. The commonest risk factors in this condition include age more than 45 years, history of trauma, genetic factors, and overweight. If the pain is not settled within 6 to 8 weeks, and if the pain is affecting your day to day activities, then you need to consider some form of intervention. Not every patient needs surgery. The foremost thing that you can start with are simple measures to prevent the progression and to give you relief. One of the commonest causes is overweight. Obesity with a body mass index more than 30 is associated with a high risk of osteoarthritis in the up to 4 to 6 times than the normal population. From a biomechanical point, just normal walking exerts up to 3 to 6 times of the body weight through the knee joint. Therefore, losing even a small amount of weight can cause great relief in your symptoms from osteoarthritis. As a simple target, losing up to 5 to 10% of the body weight can help in reducing the symptoms by up to 50%. If you're interested, let me know. I will make a separate video on weight loss strategies in osteoarthritis. The next thing you should do is physiotherapy guided strengthening exercises to the knee. This includes strengthening exercises to the quadriceps muscle and range of movement exercises to the knee joint.
Injections like steroid injections and local anesthetics can be considered under the supervision of a knee doctor. The second cause of knee pain include cartilage and meniscal tears. The symptoms include pain along the inner or outer side of the knee, clicking or catching, difficulty bending the knee, or squatting. Most of the degenerative meniscal tears improve with exercise therapy, activity modification, and with time. Requiring consultation with a knee surgeon or a musculoskeletal doctor is required if the knee locks and you are unable to straighten, associated with sharp or shooting pain, symptoms persisting beyond 6 to 12 weeks.
Third common cause is tendinitis and overuse injuries of the knee. This includes inflammation of the tendons around the knee, including quadriceps, patella tendon, and iliotibial band. The typical symptom includes pain while performing any exercise and relief while performing rest. And there can also be tenderness while feeling those areas of the knee, including quadriceps tendon, which is at the upper portion of the kneecap, or patella tendon, which is at the lower portion of the kneecap, or iliotibial band, which is to the side of the knee. This condition is common in runners, sportsperson, people who perform gym activities, and people who perform trekking or climbing. If you suspect this condition, then early intervention is required. Ignoring this condition could turn an acute problem to a chronic problem, potentially resulting in complications like tendon rupture. The treatment for this condition includes relative rest to begin with, gradual stretching exercises using physiotherapy, and then return to sports in a gradual manner. The condition will also be helped by taking anti-inflammatory medications to support pain relief and to support the inflammation. If this condition is not settled within 6 to 12 weeks, the next best thing to do is to arrange for an ultrasound scan or an MRI scan to diagnose this. If the diagnosis is confirmed, then more targeted treatment can be performed, which include long-term pain relief and activity modification, including physiotherapy. The fourth common cause of chronic knee pain is crystal-induced arthropathy, which includes gout and pseudogout. This happens when tiny crystals deposit within the knee joint. This triggers joint pain, inflammation, and swelling. Gout is caused by uric acid crystals, and pseudogout is caused by calcium pyrophosphate crystals. Symptoms include sudden onset of pain like pain overnight, difficulty walking, swelling, redness around the joint, and stiffness. The risk factors include high uric acid levels due to kidney problems, diabetes, food habits including taking high amounts of red meat, obesity, alcohol consumption, and certain other metabolic disorders. Pseudogout is caused by increasing age in association with osteoarthritis, previous injury, and certain metabolic conditions. So, how can this be diagnosed? Clinically, we can diagnose this to an extent and start you on pain medications and anti-inflammatories. But if the diagnosis is inconclusive, the next thing to do is to request your doctor to perform a joint aspiration and to test the aspirate. If the diagnosis is confirmed, then you need to consult a rheumatologist. Medications include allopurinol to reduce uric acid levels and other anti-inflammatories. This include colchicine. A short period of steroids can also be considered for this. The last but also a very important cause is inflammatory arthritis like rheumatoid arthritis and psoriatic arthritis. The symptoms include morning stiffness for more than 30 minutes, pain in other joints associated with other inflammatory changes like swelling. If you have a family history of rheumatoid arthritis, or if you have these symptoms for more than 6 to 12 weeks, the next thing to do is to confirm the diagnosis. Blood tests would be required under the supervision of the rheumatologist, and the treatment includes anti-inflammatory medications and anti-rheumatoid medications. Good control of rheumatoid arthritis is very important to reduce the chance of joint destruction due to the inflammation. Apart from medications, knee injections can also be used. If this condition is chronic and joint destruction is so severe, then we need to think about doing surgical procedures like a knee replacement. Having looked at all the five conditions in a nutshell, pain that is persistent for more than 6 to 12 weeks deserves an explanation. If the pain disturbs your day to day activities, disturbs your sleep, and has not settled with simple measures that I mentioned, then it's time to seek for further advice. The good news is that most of the causes of chronic knee pain can be managed successfully without surgery. The earlier the problem is identified, the better are the chances of keeping you active and to avoid long term joint damage. If you tell me which type of knee pain you suffer from, I will make a video on it so that I can explain and I can give you evidence based advice. And if you'd like, in the next video, I can explain common exercises for knee osteoarthritis, strategies for weight loss in osteoarthritis, or pain management specifically in osteoarthritis. So make sure you subscribe your knee doctor for evidence based advice on your knee health.